Hey class, in this recording we're going to focus on blood vessels. And as we're looking at these blood vessels, it's really going to tie together the rest of the the circulatory system. So we've talked about blood, we've talked about the heart. Now let's talk about the stuff that is going to carry the blood around after the heart moves it. So as we look at blood vessels, I can't emphasize this enough. Arteries are away, veins are back to the heart. I've said this before, I'll say it again. You need to commit this to stone cold memory. 10 years from now, after you've forgotten a lot of the factoids from your undergraduate education, you still need to have this committed to memory, tacit stone cold memory. It's that important. Now connecting the arteries to the veins, we're going to have capillaries in between. Here we have an artery. Here we have the vein, and then in between we have the capillary and the capillary beds. And as we're looking at these blood vessels, arteries and veins tend to be pretty big, and then we'll have smaller arterioles and venules, and then in between those smaller arterioles and venules, we're going to have the capillary bed made up of lots of individual capillaries. And you can see there's some structural differences between arteries and veins and capillaries. We'll talk about those in subsequent slides. So as we look at arteries and veins have three layers that make up their walls. These three layers are referred to as tunics. The root word here is tunic for coat or a cloak. So the tunic will wrap around the blood vessel. We have on the inside, we have the tunica interna. On the outside, we have the tunica externa. And then in the middle, we have the tunica media. And as we look at these three tunics, we'll start on the inside and work our way out. The innermost part of a blood vessel is the lumen of the blood vessel. And the lumen of the blood vessel is going to be exposed directly to the tunica interna, sometimes referred to as the tunica intima. And this is going to have a layer of cells called the endothelium. And this endothelium is a very special layer of cells. It's simple squamous epithelium, so it's very thin, and it overlays a basement membrane that connects it to the underlying layer, the underlying tunica media. And this endothelium is a very selectively permeable barrier. It'll let some things through, but not everything through. And this is important when we think of the nutrients passing in and out of the blood vessels as we look at those blood capillaries. Our endothelium that is going to secrete chemicals that can initiate dilation or constriction of the blood vessels, and the tunica interna with its endothelium will repel blood cells. It has a coating on the inside, protocyclin, that is going to repel red blood cells, white blood cells, and platelets so that we are less likely to have a clot form. During heart dissections, you can feel the endothelium when you cut open the heart and you shove your little finger, your pinky, into one of the ventricles of the heart or into one of the major blood vessels. It's super slippery, and that's important because we want to reduce friction that resists the flow of blood. As we look at the tunica media, went a little too far there. Let's back up here. As we look at the tunica media, this is where we're going to have a lot of differences between arteries and veins. As we look at this middle layer, the tunica media is going to have lots of smooth muscle. I need to emphasize, when we think tunica media, I want you to think smooth muscle. Collagen is kind of meh. Because you know what? Collagen is everywhere. Yes, there is collagen in the tunica media, but I'm not as excited about that collagen because it's absolutely stinking everywhere in our bodies. Something that is unique about the tunica media is that it has a lot of elastic tissue. So the tunica media has smooth muscle and elastic tissue in addition to collagen. Smooth muscle can constrict for very long periods of time without fatigue, and elastic tissue gives us some recoil. And as we're looking at the arteries, different kinds of arteries have different tunica medias. So if we look at elastic arteries, as the name implies, elastic arteries have a very high concentration of elastic tissue, which is represented by the blue lines shown here within the tunica media. And note that this elastic artery also has a fairly good concentration, or fairly high concentration of elastic tissue within the tunica intima as well. As we look at muscular arteries are going to have a much higher concentration of smooth muscle in the tunica media. And then as we look at the little arterioles, these are the small blood vessels that are right before a capillary bed. There is almost zero elastic tissue within the tunica media. There's going to be just a very, very small amount of it. So as we look at the elastic artery, these are the biggest arteries within our bodies, and they have lots of elastic tissue because they need to withstand lots of dramatic changes in blood pressure from the left ventricle contracting and relaxing or going through systole and dystole. As we look at these muscular arteries, the farther we get away from the left ventricle, the less elastic tissue we need, until eventually we're fairly far away from the left ventricle, and we have these smaller arterioles with a greatly reduced amount of smooth muscle. Also, as a key point here, let's look at our frame of reference. A smooth muscle cell right here in the arteriole is almost the entire diameter or width of the tunica media, whereas over here in the elastic artery, a single smooth muscle cell is a small fraction of the diameter of the tunica media. So these arterioles, in addition to not having hardly any elastic tissue in the tunica media, also have a greatly reduced amount of smooth muscle tissue in the tunica media as well. As we look at the tunica externa, sometimes referred to as the tunica adventitia, is the outside of our blood vessels. It's the outermost layer, and it's going to have a lot of loose connective tissue that serves to anchor the blood vessels to the surrounding tissues and organs. This layer is also going to have small passageways in it. These small passageways are going to allow for nerves to innervate the blood vessels. They will allow for lymphatic vessels to remove excessive extracellular fluid from our surrounding area. And the tunica externa also has a lot of vasa vasorum. The vasa vasorum is the small network of blood vessels that supply nutrients to those really big blood vessels. So if we back up here and we look at the elastic artery, this elastic artery has many layers of cells making up its tunica media. And those cells that make up the tunica media get nutrients from two directions. They get nutrient exchange from the lumen of the blood vessel itself, but there's not that much nutrient exchange from the lumen of the blood vessel itself. So we also need nutrient exchange from the outside, from the tunica externa, and that nutrient exchange from the tunica externa comes from this vasa vasorum, the small blood vessels that allow for the tunica media of very large vessels to have adequate nutrient exchange.